Ready?
Hi all, good afternoon.
I'm Muhammad AJMAL, an OET trainer from Jermia International Academy, and I hope you are doing very well right now. I think yes, yeah. So we can go on further. So I think you are very pleased, with our all discussions in our own modules like listening, reading, writing, and speaking. So today I'm here with one case of discussion of the patient named Mrs. Maria Stephen. Well, so many students raised many complaints or many concerns regarding this letter. So we are gonna solve it, and we are gonna, enrich you with more ideas and more informations. I hope you're ready, right? Okay, so we can start. So before moving further or before starting, I want to ask you one question. So are you planning your letter prior to writing? Are you? Or I think most of you are writing the letter or planning your letter as you go on. As you start, once you started, then you plan, right? Okay, this we can write here, or this we can write later. Like that, you are planning. But actually, most of you are not planning this letter prior to writing. So it is very important, because if you are doing some constructions, or if you are doing some projects or some researches, we all plan prior, right? Why? Because only that planning make the thing perfect. So in my opinion, it is very better if you plan this writing module or writing prior to your writing. Okay. So at first, so in my opinion, okay, it is personally my opinion. So at first you can so in my opinion, at first you have to read check the name of the patient. So here it is Miss Maria Stephen, and the age or date of birth. So the date of birth is 23/10/1943. Okay, so when you get a case note like this, then for the first name and the age or date of birth, then just turn the page and look at the writing task and read the task completely. Okay. And from there, you want to understand about the patient, the recipient details like his name, his job, and identify whether this is a non-case. Like, if in some cases there will be like patient's GP or patient's neurologist, something like that. So it is a non-case, right? So here, you can find out that there is no thing like that. Okay, just we can come into this later. And then you have to understand if there is any purpose given in this letter. Okay. So these all things should be understood prior to reading your content or your case note. So at first you have to understand the patient's name, then come to the next task, that is the recipient name, the recipient all details, and then identify whether it is a non-case or a non-case, and then you have to look at the purpose, and then at last you can go to the content. Got a case note? Okay. So while reading the case note, you have to read at least 3 times. Yes, you heard it right, at least 3 times. Why? So in the first reading, you have to make the whole story. You have to understand the whole story of the patient. At what time what happened, and at what time these things, like that whole chronology should be in your mind. Okay. And then in the second reading, you have to understand the relevance and irrelevant points. So before reading this thing, you have to be you have to think like you are the recipient. I'm the recipient, right? Okay. So if I got a letter like this, what the things that I do? For example, if you're writing to a dietitian, so you think like I'm the dietitian. So I need these all points to to check or to treat the patient, right? So you have to think like a dietitian. Only then you can understand what are the things that you needed and what are the things that you don't need. Okay. So you have to find this relevant and irrelevant points in the second reading, and in the third reading you have to organize your letter. You have to find out, is there any connection between in the first part and second part. For example, maybe in the first part they will give like the patient has some allergy, and the last part maybe they're given like he requires to avoid that food. So you can connect those two things like that together, right? So you have to identify, is there any connection between the two areas or in the 2 pages, and the main thing that you have to do in the third reading is you have to plan the paragraph. So from word to word, you can plan the first, or you can write the first paragraph, and from word to word, you have to write the second paragraph or third paragraph, so on. Okay. So this is the 3 things that we have to do to make our letter perfect. Okay. This is I'm again saying that this is my personal opinion. Okay, it's my personal opinion. You can take it or avoid, but I just try at least to make it better. Okay. But most of you are thinking like, we only have 5 minutes for reading, right? But how can we read all these things, all these 3 times reading? So, in my opinion, it will take about 10 minutes approximately. In the first 5 minutes, we know that we can't take the pencil, right? So we can only read. So we can read in that first 5 minutes, and then in the next 5 minutes also you can read. So through this way, you will get an approx or an exact idea about how you want to write your letter. So you won't get, or you won't take much time to write the letter, because you already planned each and everything. You planned what is in there in the first paragraph, what is in the second paragraph, like that. You planned everything, right? So you won't take much time. I think it will be about 20-25 minutes for your writing. So it will be very good if you plan this priorly. Okay. So now we can come into the letter. So here the patient's name is Mrs. Maria Stephen again, and the date of birth is 23/10/1943. Okay. So next we can turn the page, and then in the writing task, it is written that using the information in the case note, write a referral letter to Miss Susan Parry, charge nurse at Helping Hand Rehabilitation Center, Eagle Vale, Sydney, NSW, where Mrs. Stephen will be taken care. Okay. So this is the letter. So here it says that the recipient name is Susan Parry, and she is a nurse at Rehabilitation Center, and it didn't say that this is a known case. So you can treat it as an unknown case till now. So when coming to read the letter, from now on we have to be the recipient. So I'm the recipient, I'm Susan Parry, and I want to treat the patient, right? So the patient's address is given is 95 Eagle Vale. Then occupation is given, and she is married, and her husband is given, he's here. Then her family history is there, like her mother died at 40 due to cancer, father died at 57 due to CAD, and has 2 siblings. Her brother has this heart disease, like that. There is so many things are there. Then in the social history, they're given like she lives with his husband in own house. Home has 2 stories, 2-step to entrance, supports. There are a lot of things like that in the social history. Then diet, there is some occasional drinks. She drinks a cup of coffee a day. She reports diarrhea with the dairy products. And allergies, there is no known allergies. Then in the past medical history, she is diagnosed with osteoporosis, and the first sign is noted in the 2015. She has mild hyperlipidemia, mild hypertension, coronary artery disease, then tendinitis of right shoulder in 2019, and PTCA done in 2009 without recurrence. Okay. Then in the medication, simvastatin, then furosemide, and alendronate is there. So date of admission, it is 28/6/2018, and discharge is 2/7/2018. So the chief complaint, she had an injury on the left hip, after falling sleeping, yeah. And the diagnosis is fractured left neck of femur. That is LNOF, okay, left neck of femur. So the nursing management and progress. So on 28, what happened is she was admitted to hospital through ER. And then the medical evaluation found she was a good candidate for left hemiarthroplasty, and postoperatively IV fluids were given, morphine is given for pain, and IV famotidine is given, and everything is given. And that famotidine is given because she has some GI distress, yeah. And then on the next day, she complains that she has some hip and back pain, and patient was restless and confused with hallucination. So the next sentence is that possibly due to morphine. So they doubt that she has this type of hallucination due to morphine. Okay. So what happened? So the doctor discontinued the IM morphine and replaced that medication with hydrocodone bar acetaminophen 5 mg by 3 to 5. Okay. And and actually she was taking oral aspirin like furosemide. So she actually started that thing on this day. Okay. Then in the next day, physiotherapy was started. Then complained of dizziness and lightheadedness, almost resulting in a fall due to hypertension. Okay, so she had some dizziness, all these things. Okay, so on 1st of July, this physiotherapy is continued, and then she complained of constipation, and she didn't had any bowel movements in surgery. So this, so she complained of the constipation. So therefore, we have given Docusate 100 mg daily. Nowadays or currently the patient can ambulate short distance with walker, but she requires some assistance in her daily activities. Okay, and today, that is 2/7/2018, her dressing changed and she is ready for discharge. So this is the letter, or this is the case note. Okay, so we can just read the discharge plan also. So we need to identify why we are sending this patient to this person or this Susan Parry. Okay, so LLE, that is left lower extremity weight bearing limited to 30% for next 6 weeks. Then elderly husband not able to care for her, then home not set up for walker. So neither of children can take her in the home, lack of space, too many stays and working spouses. Decision is made to transfer her to Helping Hand Rehabilitation Center near her house. So that is the reason why we are sending this patient to that in a rehabilitation center, because her family and also her children can't take her to their home because there is no adequate facility over their home. So that's why we are actually sending, or the patient is moving to this rehabilitation center. Okay, so next thing is continue physio program and medication, and she requires assistance with the we already said that, and her staples need to be removed in day 14 and at hospital dressing. At hospital. And next is the dressing to remain dry and intact. And the next thing is the discharge medication. So this all medication needs to be continued. So this is the first reading. So we got an idea about why we are writing this letter to that that Susan Parry, the nurse, and we got the approximate idea of what the thing or what happened to this patient. So from the first reading, we can understand about this patient's almost everything, like his story. At first what happened, he had a fall, and then he was admitted to hospital, and then he underwent some surgery like left hemiarthroplasty. And the next thing is, he was given medication, but she had some side effects. Maybe it is due to this aspirin, and then physiotherapy started and all these things. Then constipation was there, so he was given this medication like that. There was. So we got some idea regarding her condition. So in the next reading, we have to understand whether it is what is needed and what is not needed for this patient. Okay. So here, the first thing is family, this married, the occupation. Occupation is there, so her marriage status is there, her next of kin, all these things is there. So we are actually writing to a nurse who is at the rehabilitation center. So we have to think like her. Okay. So whether that nurse need to know about the address or the occupation or the status? No, because we are actually sending this patient to that rehabilitation center. So she didn't want to know about this all information, and she didn't want to know about the family history also. Why? Because she is treating this patient for only this condition. Like this patient has no her family can't take her because there is no facility. So due to that, this nurse is taking care of her. So she didn't want to know about the family history of this patient. And in social history, they says that her home has 2 stories, 2 steps like that. They given everything about her home. It is also not needed. Why? Because this patient is going to the rehabilitation center, not to her home. So this is also not needed needed in this case. Okay. And then the diet is there. It says that she reports diarrhea with dairy products. Yeah, it is very important because this in this rehabilitation center, they will give some medications and they will give some foods, right? So they need to know about any allergy or anything. So she reports diarrhea is important, and that cup of coffee and occasional drink, it is not so needed. So when it comes to the past medical history, she was diagnosed with osteoporosis in the first sign is in 2015. So it is very important. Okay. Why? Because she had this injury after sleeping, right? So she had this fracture, that is fracture left neck of femur after this sleeping. It because she has this condition like osteoporosis. So we can start from there and we can go on like that. And she had mild hyperlipidemia, mild hypertension, CAD, all these things are there. So it is also important because there is some medication for all these things. So this nurse should need to administer this medication. So it is important. Okay. So these things we have to write. Then admission and these all dates are important. So when come to the nursing management, okay. So here we can find out what is the diagnosis of the patient. So the patient had, patient underwent a surgery, right? Like left hemiarthroplasty due to the fractured left neck of femur. So here The best thing or the best diagnosis is that she has undergone she has undergone left hemiarthroplasty owing to a fractured femur or fractured left femur. Okay, you can write like this. We don't want to mention about this neck of femur, or like we don't want to be that much specific, because we are sending this patient to a rehabilitation nurse, and they only want to know that this patient has some sort of fracture. Okay, and they will take care of her. It's not a problem that if you are mentioning that thing over there, but it's better that it is just needed that she has some sort of fracture in the femur. It's enough. Yeah. So next thing is so the diagnosis is that, and you can write the purpose as she requires care and assistance in daily activities. So that is important, because her home, she can't go to her home. So that's why she is going to this rehabilitation center. So she requires care and assistance in daily activities. So in the nursing management, the first thing is she was admitted through ER. That ER is needed, not needed actually. You can say like she was admitted to hospital. And then medical evaluation is there, so it is not so needed. And that left hemiarthroplasty, we can say that in the purpose paragraph. So we can avoid it in the content paragraph. Okay. Then medication, she was treated medically like that, you can give. But there is one thing that she has some sort of side effects due to the morphine. Okay, we don't know about the accuracy of that, but she had some symptoms like that. So we have to mention that thing over there. And she's taking some medication like that, aspirin and all these things are there. So it's also important. So we can write that in the in our like social history as like, or medical history like that. We can write it over there. Then physiotherapy is started, and it's need to be continued, so it is very important. And she had some complaints of dizziness and all these things. It is not so important. Why? Because we are sending this patient for the care, for the rehabilitation of this fracture. So we don't want to mention these things happen in midst of this care. We already mentioning that she has hypertension like that. We are mentioning. So we don't want to mention that she has this problem in midst of this care. Okay. Then physiotherapy is continuing, and the constipation also we can just mention, because that medication is actually continuing. So we need to mention that why she need to take the medication. Okay, and all these things in the discharge plan also we have to write down. So I think you got what is relevant and what is irrelevant. Okay. So in the third reading, we have to find out from word to word we can start, and from to word we can write the second paragraph like that. We have to organize it, right? So we can start as the from the osteoporosis, because that is the first thing that happened to this person. Okay, and then we can go to the patient's that problem, that slipping, she had an injury, and then she came to hospital like that. We can write that whole things in the single paragraph. And in the second paragraph, you can give the patient's social history, past history, and every other histories over there in the second paragraph. So you only need 2 paragraphs over here. Yeah, that's enough. Okay, so let's move on to the letter. So here the address. So here Miss Susan Parry, charge nurse, Helping Hand Rehabilitation Center, Eaglevale, Sydney, NSW. So this is the address. And the next, I return the date, that is 02/07/2018. Okay. So here, you can interchange this as, you can write the date first and then the address next. It is no problem. You can write as per your preference. Yeah. So next is Dear Miss Parry. So referring Mrs. Maria Stephen, comma, you can use DOB over there, comma, DOB, then 1 colon, then 23/10/1943. So we can check the first paragraph. So here I written is like referring Mrs. Maria Stephen, who has undergone left hemiarthroplasty following a femur fracture, or a left femur fracture. She requires care and assistance in daily activities. Okay, so you can write like this. I hope it is clear, right? Yeah. So next we can move to the content paragraph. So I just started like Mrs. Stephen has osteoporosis since 2015 and is taking alendronate 10 mg daily. Okay. Then on 28th of last month, she was admitted following a fall and underwent the surgery. So we don't want to mention the surgery again because the surgery is mentioned in our first paragraph, right? Or in our purpose paragraph. So we don't want to mention it again. So we can continue it. Then you can write postoperatively, she has been commenced on codeine as she had possible side effect with morphine. Okay, so that's a we can write like just possibility mubata. Okay, so you can start like then you can write like postoperatively she has been commenced on hydrocodone bar acetaminophen as she had possible side effects with morphine. Okay, you can write like that. Okay, and this medication, that hydrocodone needs to be continued, right? So you can write like that. So here in our discharge medication there is the dosage and all other things are given over there. So it is better, you don't want to write that doses and that all things over here. You can just do one thing. At the end of the recommendation paragraph, you can write like her medication details are enclosed here with this letter, like that. You can just mention over there. So it means that you are mentioning every details of this her medication, and you are attaching that prescription with this letter. So we don't want to mention everything about this letter or these medications. Okay. Yeah. So you can write like postoperatively she has been commenced on hydrocodone bar acetaminophen as she had possible side effects with morphine. Okay. Then you can continue like subsequently physiotherapy has been initiated. Then she complained of constipation on the following day. Therefore, Docusate 100 mg has been commenced. So this is the very concise way of writing the first paragraph. So we only taken the important things from here. Okay. Yeah. So in the next paragraph you can write like she lives with, that is Mrs. Stephen. So we don't want to mention the name in every paragraph. So we can just start like she lives with her family and has been on medication for CAD, hypertension and dyslipidemia. Okay. Yeah, dyslipidemia, or it is given as mild hyperlipidemia. So you can write like she has been on medication for mild hyperlipidemia, mild hypertension and coronary artery disease, and also here it is given that tendinitis is here given. Okay, so you can add that also over here. Okay, then you can continue like in addition she has the habit of consuming alcohol. Okay, you can just write that over here, over there, no problem. Then it is very important to mention that please note she has allergy, or she reports diarrhea with dairy products. So it is very important to mention that thing over there. Okay, so it's important, right, that thing. So this is the her social history and other past history, everything we got combined in the second paragraph. I hope it is clear, right? Okay, so we can move to the our recommendation paragraph. So you can write like your expertise, management and monitoring would be worth for Mrs. Stephen as her family is unable to look after her. So we are mentioning why we are actually sending this patient to her. So you can write like the next thing is her weight bearing is limited, right? So you can write like kindly note her left lower extremity weight bearing is limited to 30% for next 6 weeks. And it is imperative to note that her staples need to be removed on 14th day of surgery. And the next thing is you have to write like her medication list are enclosed here with for your perusal. You can write that also over there. So this is the recommendation paragraph. Okay. And then next we can write our ending note like I'm glad to assist you for any queries, and then you can conclude like yours sincerely. Yours sincerely. So here the name is actually name is given, so you can write like Miss Susan Diane, the charge nurse. Okay, so this is the way of writing or our case note of this Mrs. Maria Stephen. So I hope I made it clear. So if you have any doubt, you can just comment, and we'll be very happy to clarify it. Okay. So I think I made it clear. So the thing that you want to understand is that try to avoid the cliche methods of starting the letter, like in the purpose paragraph and also the recommendation paragraph. Try to change these all type. Yeah, you will get many type of this different type of the starting, the intro paragraph and starting way of intro. Like if you're writing like I'm writing to refer, I'm writing these type of things, and it is very common. Like it is very cliche, but it is correct. It is correct, but it is very cliche. So you can change all that things. Yeah, you can write like here you can write like an elderly Mrs. Maria Stephen has undergone this left arthroplasty. You can write just like that, no problem. And the recommendation also you can write like hopping your expert management or hopping your efficient management and monitoring, like that. You can change it. So it is better to avoid, like it would be appreciated if you could provide like that. That's a very cliche method. So it's better that you just make the evaluator impress about your way of changing or your way of modifying the letter. They say the OET actually says that you have to be very flexible with your letter. Don't keep on some sort of patterns. So this is the letter. So I think I made it clear. So if you have any doubt, then you can comment. Okay. So thank you. I hope it's clear. So bye bye.